Hi, my name is Joel, and today we are going to talk about Medicare. Medicare can really be like a new language, so there's a steep learning curve as you learn this new language. Our Medicare Made Clear program is designed to help you learn and understand that language better. Medicare is not a one-size-fits-all, and each person has a unique situation and can be served differently with different options. So hopefully you can come away today with something that will help you in your situation and get the most out of your Medicare benefits. So what is Medicare? Medicare is insurance for older Americans and those with a qualifying disability. It's paid for in part by federal payroll taxes paid by both the employee and the employer. Medicare is an individual insurance policy, so each person must qualify and apply to be covered. This is different from the traditional employer benefit plan that might cover you, a spouse, or sometimes dependents. Medicare is different from Social Security. Although you may use your Social Security number to sign up or may pay for some of your Medicare premiums out of your Social Security benefit, it is a separate program. Medicare is different from Medicaid also. That is a program funded at the state level with different rules and requirements to be eligible. And finally, Medicare is not free. On top of the taxes that you have already paid, there are premiums and cost share that follow you throughout your utilization of the Medicare system. So who can get Medicare? As you might guess, there are eligibility requirements. Medicare is designed for people 65 and older. You can get it at a younger age if you have a qualifying disability. People with end-stage renal disease or ALS may be eligible to qualify sooner. To be eligible, you need to be a U.S. citizen or a legal resident for at least 5 consecutive years. Original Medicare has 2 parts. There's Part A and Part B. Medicare Part A covers your hospital charges, things like inpatient hospitalization, skilled nursing facilities, any meals or nursing care that you receive while you're in the hospital. Medicare Part A is premium-free for most people. If you or your spouse have worked and paid taxes for 10 years, you would qualify for no-cost Medicare Part A. There's also a deductible for benefit periods during any inpatient hospitalization under Medicare Part A. Medicare Part B covers doctor's office visits and other outpatient care, things like labs that your doctor may order. It also covers some preventive screenings and includes things like durable medical equipment. A sleep apnea machine might be an example of that. Medicare Part B does have a monthly premium, and it is adjusted for income. There is also an annual deductible that you must satisfy first, and then you have a 20% cost share or co-insurance. That means that after you meet your deductible, you pay 20% of any bill, Medicare pays 80%. You are able to see any provider that accepts Medicare to receive these benefits. You can't be denied coverage for Medicare Parts A or Part B. You do want to note, if you do not sign up for Medicare Part B when you are first eligible, you may see a penalty if you enroll in the future. To avoid paying that penalty, you want to ensure that you have creditable coverage in place. That way, if you decide to take Medicare Part B down the road, you would not see that penalty. It's important to remember Original Medicare doesn't cover everything. There are out-of-pocket costs for you. In addition, it doesn't cover things like prescription drugs, dental, vision, and even hearing. Because Original Medicare doesn't cover everything, most people are looking for additional coverage. One option for that additional coverage would be to purchase a Medicare supplement plan. In addition to that supplement plan, most people would purchase a Part D prescription drug plan. That helps pay for your prescription drug benefits. A secondary option would be a Medicare Advantage plan or a Part C plan. This rolls your Medicare Part A and Part B coverage into one, and often even includes a Medicare Part D prescription drug plan as well. Keep in mind, while Medicare Parts A and B are offered through the government, these additional plans are available through private insurers. Medicare supplement plans offer additional coverage to your original Medicare plan. Now, this can get confusing because they are usually identified by a letter. These plan designs are all determined by the Center for Medicare and Medicaid Services, or CMS. So those plans are set in place. and offered through private insurance companies. Although your plan may be the same, a Plan G with one company is the same as a Plan G with another company, they may have different premiums between those companies. So it's important to shop those plans and make sure you find the one that is the best fit for you. Medicare supplement plans are good across the country. You can use any provider that accepts Medicare. If you sign up for a supplement plan when you are first eligible, there's no underwriting and no exclusions of pre-existing medical conditions. That guaranteed issue period, as it's called, is for the first 6 months of your eligibility in Medicare. If you want coverage for prescription drugs, you would need to purchase a Medicare Part D prescription drug plan. Your Part D prescription drug plan will help cover any prescriptions from your doctor. There are also vaccines covered under the plan, and there is a list of prescriptions specifically covered by each plan. That's known as a formulary. So you do want to review this formulary and make sure that the prescriptions you need are covered by the plan you select. The costs for your Part D prescription drug plan are your premium that you would pay monthly, and then any cost sharing that would be included in that plan. Most Part D plans do have a deductible, and then you would typically pay a copay. Most standard plans have a 5-tier setup, and depending on what tier your prescription falls on, that would determine the copay for your prescription. Enrollment in a Part D prescription drug plan is not required. However, if you delay enrollment and do not have creditable coverage, there is a penalty for signing up late. If you already have coverage today and it is creditable, you don't need to worry about it. But if you have no prescription coverage, even though you don't take prescriptions, you might want to consider enrolling in a Part D prescription drug plan. Another option for additional coverage is a Medicare Advantage plan. This is often incorrectly called a Medicare replacement plan because a Medicare Advantage, or a Part C plan, includes your coverages from Medicare Part A and Medicare Part B, and often includes your Medicare Part D coverage as well. There are also additional benefits under Medicare Advantage plans like dental, vision, hearing, or even gym memberships. If you select a Medicare Advantage plan, you're still required to pay your Medicare Part B premium. In addition, your Medicare Advantage plan would have a premium, but one consideration is these can often be as low as $0. Medicare Advantage plans do have a defined annual out-of-pocket maximum, so you know the most expense you would have in a given year. Medicare Advantage plans typically have a network that they work within as well. You would want to check your plan to make sure that your doctor is available on the plan that you select. Keep in mind there are many different types of Medicare Advantage plans, including special needs plans that you may be eligible for. When you're ready to enroll for Medicare for the first time, there is a specific time frame you have to do that. This is called your initial enrollment period. You are eligible the month that you turn 65, the 3 months prior, and the 3 months after your birth month. Now, if you're already taking Social Security benefits, you will be automatically enrolled in Original Medicare. If not, you do need to actively sign up for the program. If you miss this initial enrollment period, you do still have opportunity down the road. However, if you don't sign up for Original Medicare Part B when you are first eligible, and you don't have creditable coverage, you may pay a penalty when you do sign up for Original Medicare. In addition to the initial enrollment period, there are special enrollment periods that you might qualify for. Qualifying events for this would be items like retiring and leaving your employer benefits, a change in marital status, or a move. If you plan to work past age 65 and maintain your employer benefits, you can delay your Medicare Part B and Part D enrollment, but you may see a penalty if your employer coverage is not creditable. Once a year, from October 15th to December 7th, you are able to change your coverage if you so choose. This is called the annual enrollment period. Any changes you make during the annual enrollment period go into effect January 1st of the following year. If you need help paying for Medicare, you can apply for extra help. Do this by reaching out to Medicare, the Social Security Administration, or by contacting your state's Medicaid program to see if you qualify. Thank you so much for watching. Hopefully we were able to clarify some of the language of Medicare. If you need additional resources, you can always go to MedicareMadeClear.com, or to find a local agent, you can go to myuhcagent.com.